Welcome to the 2022 update on Social Security and Medicare. We're so glad that you joined us today. Thank you so much. I am Heather Majka, and I wanted to share this update with you. I just wanted to tell you a little bit about myself. I'm the owner of Citizens Insurance Solutions. I have more than 25 years of experience. Believe it or not, it's been 29 years. I just added that up the other day. I'm a Blue Star mom, so let me tell you a little bit about what that means. I have an active duty son, Timothy, who's 23 and is U.S. Navy Air Crew. He's currently stationed at the FBI right now. And I have a daughter, Amanda, and she's 18 with the U.S. Army, stationed in Vilseck, Germany. I'm also a wife to my husband, TJ. He's a combat vet from Desert Storm and the Tellico Village VFW service officer. And I'm a dog mom of Colonel, who's 3. Wonder how he got that name. And Lucy, who's 10. She's a rescue from Maryville. Let me tell you what we're going to talk about today, because obviously we're not just going to talk about me, but we'll talk a little bit about what Citizens Insurance Solutions is and why we do what we do. And then we'll really get into lots of data about Social Security and Medicare and our federal budget and what the state of affairs are. Just a little bit about Citizens Insurance Solutions. What we do is we help people with Medicare health insurance plans, whether it's Advantage, supplements, or drug plans. We help apply for Medicare, Social Security, health insurance for people of all ages, and any budget really for that matter. We also help people plan on when and how to file their Social Security. In fact, I am the Tennessee's only Social Security claiming strategist, which is why I've been honored to share this update with you. We also offer other types of insurance like dental, vision, travel, and cancer, but enough about that. Why do we do what we do? Well, one reason is we care about health, spiritual, emotional, physical, and more. It all ties together. So we very much care about health. We also care about you and your family. So we want to help you and we want to understand what your goals are and help you be the healthiest that you can be. Now, yes, we are great philanthropers and we do support a lot of great causes in our community, but we get paid to help you. So if we are able to help you with insurance, we are paid a commission from the insurance company and you don't pay more to work with us. And the bottom line is we're blessed and we want to bless others. Some causes we support, just to quickly name a few: the Office on Aging, Mobile Meals, CREVA, Medicare Fraud Patrol, the Parkinson's Organization, Lions Club, VFW, suicide prevention, and more. All right, so now that we had our commercial, let's really talk about what we're here to talk about, our 2022 Social Security update. The first thing we're going to talk about is the federal budget. Trust funds, we'll be talking about what are the trust funds, and we'll talk about some information about Social Security benefits and the solvency of the Social Security program. Okay, so the trustees, the reason why we're talking about the 2022 update, one, obviously next year is around the corner, but two, there was a report released by the trustees August 31st that was about 200 pages long, and many media outlets have picked this up and try to analyze it. I am going to give you just facts with zero opinion, and you can see for yourself kind of some information that was extrapolated from all that data collected. The purpose of the trustees report is to alert Congress to impending insolvencies of the programs so that legislative changes can be made in time to the programs to bring an actuarial balance. And that just means they want people to be aware of, what's going to happen in the current state. And we believe, I want you to know that we are not believers in kind of like a doomsday type situation. We believe that even though there hasn't been anything passed yet to make any changes to the program to help the solvency, we do believe that as the date draws near, we will have some bipartisan bills that will get passed. So we do believe that. So I talked a little bit about this trustees report. We're going to look at some aspects of it, but who the heck are the trustees, in case you're wondering? There's 6 trustees, 4 of whom serve by virtue of their positions in the federal government. and that would be the Secretary of Treasury, the Secretary of Labor, the Secretary of Health and Human Services, and the Commissioner of Social Security. There's also two other trustees that are public representatives, but those seats have been vacant since 2015. Each year, the trustees report on the status in the fund. Okay, so the funds that we're going to be talking about today are four different funds. It's the the OASI fund, which stands for Old Age and Survivor Insurance, and that pays retirement benefits to survivors and retirees with Social Security. Then we're also going to talk about the DI fund, which pays disability benefits. We're going to talk about the Medicare HI fund, which pays for Medicare Part A benefits, and the SMI fund, which pays your Medicare Part B and D benefits. Okay. Sorry about that. Okay, here we go. All right, so each year I told you that the trustees report on these funds. This is the balance, and it's in terms of billions of dollars. So you can see, obviously, the Old Age and Survivor Fund has a lot of money in it right now. And the other funds are a little smaller. Congress established these trust funds that are managed by the Secretary of the Treasury to account for Social Security and Medicare income disbursements. It's also a mechanism to kind of keep everybody accountable, but also to make sure that we can pay our obligations. The data and projections presented to the best estimate of the trustees does take into consideration the impacts of COVID-19. Okay, so Social Security is largely a pay-as-you-go program. So, and you have to forgive me, I'm using some notes here. Most of the payroll taxes collected from today's workers are used to pay benefits to today's recipients. In 2020, the OAI fund collected and the DI fund together, so those two funds collected $1.1 trillion of revenue. Of that amount, 89.6% was from payroll contributions and reimbursements from the general fund of the Treasury, and 3.6% was from income taxes on Social Security benefits. Interest earned on government bonds held by the trust fund provided the remaining 6.8% of income. Assets increased in 2020 because the total income exceeded the expenditures for benefit payments. Now we're going to talk about the GDP, okay? The United States is the world's largest economy, and it has been for decades, forever, actually. As long as the US has been around anyway. In the 50s and 60s, relatively speaking, our GDP has decreased its rate of growth compared to then, but we still remain the #1 economy. And despite what we're going to talk about today, we've seen little impact on our position or other countries' position as far as the size of their economy. Social Security is about 4.8% of our GDP, and Medicare is about 4.1%. So at a glance, you can see that mandatory outlays net of receipts by the federal government in 2020 was $4.6 trillion. $1.9 trillion is what they outlaid for Social Security and Medicare for 2020. Mandatory outlays, and we're going to talk about mandatory and discretionary spending in our budget, but mandatory outlays in our federal budget represents 21% of our GDP. I already told you about the GDP and what percentage Social Security and Medicare were. We did experience, and if you're on Social Security, you realize this, a 1.3% COLA increase for 2021. We have yet to hear what the 2022 number is. We'll actually hear that in November, and maybe by the time we're doing our Q&A, I'll have that information for you. I have some speculation. We'll see if we go into that later on of what I think it might be and why. But let's just recap money spent by the government in 2020, okay? There was $3.4 trillion of revenues, and we had $6.6 trillion in outlays. 46% or 4.6 trillion dollars was mandatory spending. Mandatory spending is something where Congress basically has to pass it unless there's some kind of underlying law. Discretionary spending is something that's subject to the appropriations process, and Congress has to set a new level each year for that. So mandatory spending simply doesn't need any legislation. It's going to automatically get approved, okay? So you can see our mandatory spending in 2020 was very large, obviously, in our healthcare programs, Medicare, Medicaid. Second to that was Social Security and disability, which is obviously very important programs. And then thirdly was your income security programs that were to help offset the impacts of COVID-19. And we also had the Paycheck Protection Program, which was a part of that. Just one more look at kind of where our revenues came from: payroll taxes, individual income taxes, and then our outlays, Social Security and Medicare and Medicaid obviously being very large parts of that. So what are the trust funds? The trust funds are accounts that are managed by the Department of Treasury, serving two purposes. I told you that, the accounting mechanism, and to help make sure that we're aware of what our debts are and how at the current projection levels we'll be able to maintain that. How are the funds invested? People always wonder this. By law, income trust funds must be invested on a daily basis in securities guaranteed as both principal and interest by the federal government. All securities held by the trust funds are special issue of the United States Treasury, and such securities are available only to the trust funds. In the past, trust funds have held marketable Treasury securities which are available to the general public, but unlike marketable securities, special issues can be redeemed at any time at face value, so that makes them risk-free. Money to cover the program costs, mainly benefit payments from the trust funds, comes from the redemption or sale of securities held by these trust funds. When special issue securities are redeemed, interest is paid, okay? And sometimes I get the question, like, were assets reserves of the Social Security trust funds ever depleted in the past? And what I've found is the reserves of the largest trust fund, the one that pays survivor and retirement benefits, the OASI fund, was nearly depleted in 1982, but no beneficiary was shortchanged because Congress enacted temporary emergency legislation that permitted borrowing from other trusts, and we were able to pay those trusts back with interest within 4 years. So thankful for that. So just some key takeaways of what we just talked about. I wanted you to know that, yes, there was a significant effect on the program finances due to COVID-19. In fact, we'll look into that a little further when we talk about Medicare in particular, and those trusts, the funds that fund Medicare. But I will say that employment, earnings, interest rates, and our GDP did drop substantially. But again, we're still a world-leading economy, and everybody's position on that chart regarding economy size across the world has remained pretty constant for the most part. We did have an increase in mortality projected through 2023, which is part of the assumptions used when analyzing the trustees' report. I didn't make that assumption, that the government did. Projections show without reform that benefits will only be able to pay 75% of benefits for retirees and survivors, actually, by 2033. And I didn't mention that, but as it stands right now, with the projections and assumptions, If there isn't any additional legislation, we will only be able to pay 75% of benefits to retirees and survivors starting in 2033, which is 1 year less than what they anticipated last year. And that's due to many factors that we talked about, COVID-19 and substantial outlays and so forth. Now, people who are on disability, they're funded through that DI fund, and that's fully funded through 2057, at which time it's only projected to decrease into 91% of benefits paid. And again, we are of the mindset that while there's always constant legislation proposed regarding these matters, that as it gets closer, there will be bipartisan bills that are passed, we think, that will help basically consider this. And there's all sorts of different philosophies on how we can increase the solvency of Social Security, but we're not going to get into that because we're going to be doing so much other data. But I just wanted to mention to you that there were lots of things that people are proposing, but nothing that's actually stayed and been agreed upon. I will say too, one thing to note, I didn't mention this in the slides, but one thing I did note in my research is COVID-19 cut the US life expectancy the most of anything. It actually decreased, according to the data, about 2 years. So we were at about 87 average male or female life expectancy, and it dropped about 2 years because of the impact of COVID-19, which was the largest drop that we've seen since World War II. A couple of takeaways from everything I just talked about. Don't jump on the bandwagon that Social Security is going broke. Be realistic about your future income needs, plan, save, and invest. I mean, that's the most important advice I can say. Just don't jump on that bandwagon. There's a lot of banter out there to kind of scare you into thinking that it's going broke and trying to get you to make some sudden moves, and I don't recommend doing that. In fact, I always recommend that you work with someone on these issues that you can really trust and is an expert in this area. So let's talk a little bit about Social Security benefits. Did you know that 69.8 million people received benefits from a program that was administered by Social Security in 2020? That's a lot of people. 5.8 million people were newly awarded Social Security benefits in 2020. And 55% of adult Social Security benefits in 2020 were women. So more women are receiving Social Security than men. And 55 is the average age of a disabled worker in 2020. Okay, let's see. Oops, I didn't mean to do that. Pressed the wrong button. Sorry about that. Okay, so just another little factoid. The average retiree Social Security check for just Social Security alone in 2020 was $1,555. That's the average monthly benefit. And for disabled workers in 2020, the average disability payment was $1,280. Okay, so I thought that was interesting. Retired workers and their dependents were accounted for 75% of total benefits paid. Disabled workers were about 13%. And by the way, 89% of workers aged 21 through 64 don't actually have any additional disability insurance available to them. They rely solely on Social Security if they were to become disabled or suddenly deceased and had dependents. Survivors of deceased workers accounted for about 11% of benefits paid, and more than 1 in 8 of today's 20-year-olds will actually die before reaching age 67, which is astounding to me. And 96% of people ages 20 to 49 who worked in covered employment didn't have disability insurance. So I just said that. It's a big deal. Social Security is a very important program. In 1940, the life expectancy of a 65-year-old was almost 14 years in addition to age 65. Today, it's over 20 years. So people are definitely living longer. The number of Americans 65 and older will increase from about 57 million in 2021 to 76 million by 2035, based on our current projections. And just a note, we talked a little bit about how Social Security is a pay-as-you-go program. Well, we'll get a little bit more into that in detail, but the part of the benefits are actually from people working. And because we didn't have a whole lot of people working in 2020, that helped to fuel the shortfall here. It actually takes about 2.7 covered workers for each person working to actually fund one person on Social Security. And we project that by 2035, the number of workers that it will take actually could increase. So, oops, I don't know what happened. I pressed something again. All right, sorry. I just told somebody that I was actually good at PowerPoint. I might take that back. Anyway, so Social Security is a major source of income for most of the elderly. In fact, 9 out of 10 people aged 65 and older are receiving Social Security benefits as of December 31st of 2020. And it represents nationwide about 30% of the income of people over 65. I want to talk specifically about Tennessee because our state is a little bit unique in this matter. We'll talk a little bit about the population of the state of Tennessee, some income statistics, and the role Social Security plays here in Tennessee. So unfortunately, we didn't have any 2020 Tennessee data that I can get my hands on easily, but the total population in Tennessee in 2019 was 6.8 million and some change. Adults over 60 was 1.5 million and some change. And just so you know, 60 and older is about 23% of our population in Tennessee, so it's very important. About 9.7% of people are living in poverty in Tennessee that are over 65. So 10% of our senior adults are living in poverty. And believe me, just because you're not in that statistic doesn't mean you're really high rolling. You could really be struggling and not be at poverty level because poverty level is extremely low. So just a couple other stats about Tennessee folks. 22% of the seniors in Tennessee are veterans. 20% of them are living alone. 8% of Tennessee senior households have an annual income of less than $10,000. Can you believe that? 30% have an income less than 30,000, or excuse me, 20,000. So 30% have an income less than 20,000. And 26% of Tennessee residents 60 and older actually received food stamps last year. The average Social Security income in Tennessee is $16,841 a year. Now, that's not poverty level, but that's not a lot of money. In fact, I wanted to share with you that without Social Security benefits, 37.8% of elderly Americans would have income below the poverty line. So that's astounding. Social Security is a hugely important program, and there's no doubt about the fact that anyone elected would have pressure on them to keep this program going. Little break from all the stats. I just wanted to tell you a little bit about the family again. Remember I told you about my husband. He's a U.S. Army veteran, sniper in Desert Storm. So that's him, that's TJ, and that's my daughter, Amanda. A picture of her at Vilsec at a coffee shop. And that's my son, Tim. I don't have very many pictures of him, but I got to see him at Christmas time. You notice we're all short. And that's my daughter, Amanda, again. So just thought I'd give you a little break from the facts and figures. All right, so let's recap a little bit, let's go over some important notes anyway. Social Security is a very important source of income. We talked about that. I know what I was going to tell you. So we don't have the COLA increase of what that's going to be, but there are some reports that point to the fact that it's going to be the highest we've seen ever. So we'll see if it is, but there's a projection out there that's going to be about 6%. I don't want to get anybody excited and go out spend that money yet until we know for a fact the first couple of weeks of November. And let's see, the COLA I said that. And Social Security offices, this is important to note, Social Security offices are still closed to in-person appointments unless you meet a certain criteria. If you're new to Medicare or you have issues with your Social Security card or number and you are at risk or somebody who cannot do business over the telephone, then you are able to call Social Security and make an in-person appointment, but you cannot go by the office any longer without an in-person appointment. Most things can actually be done online. So that's why I'm showing this screen here. You could, look at your benefit statement, look at your earnings statement, estimate how much you're going to get later on down the road. You'll still need some advice from a professional if that's not enough information, but not everybody needs that. And we help with applying for Medicare or retirement, or we don't actually help with applying for disability benefits, but we can certainly get you in contact with legal aid or a local disability attorney if you wanted to, have part of your money held back. But legal aid will do it for many people. But there's lots of things you can do online still. Order a new card, change your address, file an appeal, apply for benefits. So, and we help you do all that. We have actually videos on our website on how to do lots of popular things. And there's actually a chat box on there now. So, because when you call Social Security, I didn't mention this, but they handled so far in 2021, Social Security has 60,000 employees. They are mostly working remote, except the people that are in the local offices by appointment only. And in 2021, they've already handled 48 million calls. In 2020, they handled for the whole year 57. So I have a feeling we're going to outpace this year's calls by next. And some people do have a 1 or 2 hour wait time depending on when you call. And they do have that service where you can press your number in and it'll call you back when they're available. Every now and again that glitches, but for the most part that works pretty well. But you definitely can call Social Security, and if you aren't comfortable with computers or you don't want to work with someone like the Office on Aging or myself that can help you guide you through these things, you can make a telephone appointment and they can help you over the phone with most of the applications. I will also note that they're test piloting a new benefit statement. So it hasn't rolled out to everybody, but if you have an online ssa.gov account, which I completely encourage everyone to get, because if you don't get it, the odds are a hackster could. So I do recommend that you create your own ssa.gov account, even if you plan on not using it. But some may see this new modernized statement about your earnings. It's supposed to be more clear about the effects of waiting to draw your Social Security until your full retirement age or later, and what your earnings are. So hopefully that is more clear for you. They'll be rolling that out to everyone soon, so stay tuned on that. Again, just to kind of recap everything we talked about, just remember, plan, save, invest, be realistic about the future. Don't jump on a bandwagon that Social Security is going broke. Okay, so I went a little quicker than I thought. It's probably because I don't know exactly where all my little facts and figure notes are, but that's okay. Good thing I'm an expert and know all this stuff by heart, I guess. Let's talk a little bit about the Medicare 2022 update. We're going to talk a little bit about premiums, although we don't have as much information as we'd like. We're going to talk about the funds, the trust funds again. Remember, there were 2 trust funds that Medicare gets paid out of, the HI and the SMI trust fund. We'll talk a little bit about Part D, hopefully some proposals of what might be in the future, and revenue and some takeaways. So let's talk about spending, program letters, Part D, and some upcoming changes. All right, so we don't know what the Medicare Part A, B, A shouldn't have a premium unless you didn't work enough and you have to buy Medicare Part A, but the premiums change every year. And for 2022, we have not had those numbers released. But for 2021, the base premium for Medicare Part B is $148.50. Now, what do I mean about a base premium? It just means people that have higher incomes, so about 5% of Americans, will pay more than that based on their income 2 years ago. So it does adjust every year. So when they release the 2022 numbers, we'll know what the premium will be for 2022, but they're going to look at your adjusted gross income from 2020 to determine if you pay the base or pay higher. And there is a staggered amount depending on how high you go up. Now, the average cost of a Part D plan nationwide in 2021 was $31.47. And in 2022, it's actually going to be $33. Again, we don't know what the deductible and some of the other copays are because they just haven't been released yet. So we'll have to wait and stay tuned. Oops. Okay, sorry, I didn't mean to go so fast. All right, so on average, it's possible that you could spend up to, depending on what your income is and what your medications are, but you could actually spend conceivably $7,000 or more on prescription drugs, even with insurance. So that's very important that you know that there are programs out there, even if you're not on the poverty level, there are programs available to help offset the cost of prescription drugs. And definitely there's insurance to help with out-of-pocket costs, but our data shows that on average, if somebody was saying, hey, I'm about to retire, I need to think about how much should I plan for out-of-pocket medical expenses, even with insurance in the future. We say that you should actually plan on average of spending $6,300 every year from now until you pass for expenses, whether it be, co-pays, co-insurances, drug expenses, things not covered by Medicare, perhaps, dental. I will tell you that this is not a big shock, but as you age, your healthcare costs significantly increase. So you'll definitely see that for average annual out-of-pocket Medicare spending for ages 85 plus goes way up. I just said budget around 6,300. For males, it's about 9,800, and for females, it's about 10,500 when you're 85 plus, and that's factoring in long-term care, home health care, dialysis, and so forth. We also say kind of budget on average, again, we don't have the 2022 numbers, but about $388 just for Medicare alone. So that doesn't include any other additional insurance. Another interesting factoid, I think, is 35% of people age 65 and older have an activity limitation. Why do I bring that up when we're talking about costs and Medicare? Well, if you have some kind of limitation, not only does that mean you need some kind of physical support or treatment, but you also need emotional treatment and physical emotional support, because anytime there's something wrong with our body, it affects our overall, health and well-being and our joy for the day, right? We have to make a more conscious effort to enjoy life when we're hurting. So, or have some kind of restriction, or we're shut in because of COVID, or we're vulnerable. Just a median cost of an assisted living facility in general nationwide as of 2020 was about $4,000. $2,000 was the maximum assets to qualify for Medicaid. We really didn't talk about what the income amount was, but for Medicaid itself, it's typically going to be under 100% of the poverty level. And then for other programs to help with the cost of out-of-pocket expenses when you're on Medicare, it could be as much as 135% of the federal poverty level. And then for extra help for prescription drugs, it could be as much as 150% of the federal poverty level. And keep in mind that you can have higher resources than $2,000. So again, if you're unsure of whether or not you qualify for this, if you just even have any inkling that could be you, please reach out to us or the Office on Aging, and they can help you with that. We want to help. You can also call Social Security, but they're somewhat limited in what they can do. So who pays what under Medicare Part D in 2022? Now that we know, because they've already released, like I said, the national average of a prescription drug cost is going to be about $33. They've made it, all Medicare Part D plans are different. They cover different drugs. They're going to have different rates. Anytime you look at any medication, any pharmacy, and any insurance, when you change any combination of those three things, your costs change. It's very important you understand that. So I had a lady in my office just a moment ago who said, well, CVS pharmacy is the cheapest all the time. Well, I said, that may be the case in your situation with that drug and that insurance, but that's not always the case. It really depends on your personal situation. So I say all that to say, Medicare Part D plans are also similar. They have to be what they call actuarially equivalent. So they have to basically work on the same benefit design. It doesn't mean that they all have the same drugs covered, but they have to have the same benefits design. So no drug plan can have a deductible over $480. In the initial coverage phase, you're going to pay 25% of the cost of the drug, no more than, in the form of copays or cost sharing. And then now there's a donut hole that's supposedly eliminated, and it looks like there's not a change. It says you pay up to 25% of the cost of the drug. So you think, well, that's the same. Actually, no, it's not. Depending on your situation, so we recommend that every single person get a personal analysis of what their medication costs are going to be on their current plan or whatever plan they're thinking about joining next year, month by month, so they can have an estimate of what they can expect, because most people's drug costs change month to month and from year to year. So you do want to have an idea, because not everybody's going to get into the donut hole. People who are in the donut hole, not everyone will experience an increased cost. Some will, some won't, and so on and so forth. So we want to make sure that you understand which drugs you're on. Do they apply to the deductible? Do they not? And so on and so forth. And, if you wanted to look at another pharmacy, would that help? Or would it change in your insurance help? Or what would help the most? Just a plug to our local pharmacies. We completely support our local pharmacies and the relationship that people have with their pharmacists, and bringing business locally. So, don't necessarily just leave your pharmacy when you could possibly change your insurance or maybe even your medicine. So those are all factors that we can look at. Some key takeaways are: don't jump on the bandwagon that Medicare is going broke. Make sure that you know your monthly costs each year ahead of time. If you were planning and you had all the ability to plan for your expenses, plan about $6,500 a year for your out-of-pocket expenses. And then again, you've not heard me say this at all, but be realistic about your future and income needs by planning, saving, and investing. So something I wanted to talk about, I know we're kind of getting short on time, but we're getting close to the end, is what we think the 2022 Medicare premiums are going to be. Now, this is speculation actually, but I wanted to tell you what happened to the Medicare premiums in 2021. So you can kind of see where we're going with this. In 2021, the premium for Medicare was actually artificially reduced to 25% of the normal amount as a part of the COVID relief bill. This means that there's a clawback of that amount plus the usual amount based on projected expenses. So the 2021 premium rose by just $3.90 from $144 the prior year in 2020 to $148.50. Without that 25% cap, the premium this year for 2021 would have been $160.20. So we're really interested to see what's going to happen to the premiums for 2022. Are they going to be able to pass something to hold them down and make a cap again? Or is it going to rise as high as 168, which compared to 148 is about a 13% increase. So that's going to really be a huge lick. So we'll just have to see. And we don't know what's going to happen with the COLA either. The Medicare Part B premium is determined by Medicare spending. It's projected per capita by Medicare spending in 2022, multiplied by 25%, which is the share that's paid by beneficiaries. In 2020, the annual report, Medicare trustees projected that the 2022 base premium was going to be about, for Part B, $157.50, but we don't know. So we threw around 160, 150, we don't know. Enough about that. Let's talk about what's happening with people who are on Medicare. What kind of options are they choosing for insurance and why? Well, it looks like Medicare Advantage has been continually the case. Now, this is a chart that's a graphical chart from 2018, but I just wanted to show you that in 2018, about 39% of people chose Medicare Advantage, about 21% chose Medicare Supplement or Medigap, about 18%, and that's going to be fewer and fewer as the years go on, had employer insurance available to them as a retiree. So these are not your people working, but these are people who are retired. 12% were on Medicaid, and then 10% just didn't have anything. That was in 2018, okay? In 2020, you can see that Medicare Advantage is a huge growing option, and actually that's the leading option chosen now by people. And it doesn't mean it's right or wrong or good or bad. It just means that a lot of people are accessing that, and that can be for various reasons. But you can see Tennessee is well over 40% with people on Medicare that are in a Medicare Advantage plan. Quick note, if you had to ask nationwide, the number one Medicare Advantage plan is United Healthcare, number 2 is Humana, and number 3 is Blue Cross and its affiliates. It's not exactly that way in East Tennessee as far as market share, but that is the case nationwide. Medicare Advantage plans have become a very popular option because they're low cost. And obviously, I just told you that seniors have lower income, relatively speaking, than the national average, but they have lots of benefits. Now, there's things that you have to give up to get these benefits, but glasses, telehealth, dental benefits, fitness benefits, hearing aids, access to supplements, over-the-counter benefits, transportation, safety, in-home support, and more. So that's one of the reasons why it's a very popular benefit. When I mentioned, well, you know, there's all these good things and it's lower cost, why wouldn't I just get this? One thing to note, one of the things that you're kind of being restricted by is you may have to get prior authorization for certain services. In fact, most plans do require prior authorizations for Medicare Advantage on most services. And that just means you have to get the insurance company's stamp of approval to get them to pay for something that's definitely covered by your plan, but are they going to pay for it? That's the question. And that may not be unfamiliar to you if you had an insurance plan while you were working. That was probably something that they had to do then. So again, just to sum up, we haven't gotten the 2022 Medicare premiums released yet. The Medicare Part B premium is based on your income 2 years ago. So every year they always look back 2 years. So in 2023, they're going to look back at your income, adjusted gross household income for 2021. Medicare Advantage is an attractive option and is the number one choice right now for Medicare beneficiaries. And again, you've not heard me say this, but be realistic about your future and your income needs by plan, saving, and investing. Uh-oh, here comes my dogs. That's Colonel. He's my yellow lab. He's 3. And that's Lucy. She's laying on the bed there. She's my rescue. She's 10. She's from Marable. Again, I know we're running out of time here, but I just wanted to tell you that legislation, there have been 9,200 pieces of legislation brought forward and only 47 enacted laws. But since, oh gosh, let's see if I have this number. Since World War II, we've enacted like 5 million new words of legislation. Even though we're not necessarily passing more laws, we're making the bills bigger. So I just wanted you to kind of see that. Some things that people are talking about for Medicare, not as far as the solvency goes, but what to change about the program. The American Dental Association is trying to get, obviously, dental benefits covered. Let's see. Tennessee, by the way, was the number 3rd lowest in healthcare spending in the country, which I was really surprised about. Maine was the highest and Wisconsin was the lowest. I say I was surprised because I've been in this industry a long time, and I know in years past, Tennessee was really high in spending utilization, and unfortunately, with the health of our seniors and our people of any age, actually. So just real quick, this Medicare update, what does it mean for you? Make sure you know your 2022 out-of-pocket drug costs. Make sure you understand your plan changes. If you're on a Medicare Advantage plan, you'll have gotten a notice that compares what the benefits were last year to this year. Look at that, but also make sure you know what your drug costs are going to be each month into next year. Make sure if it's not us that you work with, we would love to help you. We're non-biased because we represent every single company and option, but you know, you've got the Office on Aging, the AMOS program, you've got SHIP, you've got lots of other non-biased professionals out there. You know, yes, you can call 1-800-insurance company, but just keep in mind they can only tell you their option, their solution, and they have an agenda too. A few key dates, you can preview Medicare plan options until the 14th, starting on the 15th of October. So that's this Friday. You can actually enroll or change your plan, Medicare Advantage or prescription drug. and that ends December 7th. So that's your Medicare Advantage open enrollment period. People who are not on Medicare can get a individual health plan starting November 1st, and that goes all the way to January 15th, which has been extended. By the way, any changes that you make between October through December for Medicare or to your health insurance for this year in the open enrollment period, that does not take effect until January of next year, unless of course you do it after January 1st. That would take place in February. Look for that COLA announcement, look for those premium announcements. Anybody who we've done business with in the past will release those to you. We'll also release those on Facebook and Google and all that fun stuff. So just to follow up and wrap up, help us help you. Ask us questions. We want to help you understand. We want to help you decide. We're happy to tell people you've got exactly what you need. You don't need to change a thing, or recommend some changes if need be. Tell your friends and family about us. We're all over the country. We have licenses in 25 states. We've got a great team to help people. And anytime you refer someone that we can help, we can make a donation to your local charity of your choice in your name, or maybe give you a small gift if you don't want that. Leave us a great review on Google. Follow us on Facebook. Those are all fun ways. Now, we've got a website, www.citizensinturancesolutions.com. We also have www.more-than-medicare.com. So we've got lots of ways to reach us. And that's pretty much it. So I appreciate you tuning in and listening to that.